So we are all here for the Paramedic Refresher program. This is our EMS 206 class. It is presented by EMS University. This is the company I work for. Oh, yeah, that's right. I got to click this. All right. So the program overview. This is going to be the introduction to the program. At the completion of this lesson, the Paramedic Refresher student will be able to understand the requirements necessary in order to complete this course successfully, understand the scheduling requirements of the course, and identify the missions and goals of EMS University. This class will be held, it says here actually 4 days, but it's actually been consolidated to 3 days because of part of y'all's lecturing is online and the other part is going to be live. So you're going to have three 3 8-hour days instead of 4. So it says here Wednesday students will complete a 5 online self-study lectures. Okay, so the way this is going to work out is y'all got y'all's lectures online. Just complete them as we're going through this, but they all have to be completed before you take the final exam on. I think the class ends Friday. It was Wednesday, Thursday, Friday. Yes. Final exam will be Friday afternoon. It opens up at 4 o'clock Pacific time. It says here it's gonna be from 4 to 6. It's actually open for you for as long as you want. So, or not as long as you want, but actually for like, I think it's like a year. So if you do not feel like taking the final tonight, you don't have to take it tonight. So or that Friday night. So what I would do is go through the class. At the end of Friday, you're probably gonna be fried. So maybe take that night to study, maybe kind of brush up on things, and then come back Saturday and take it where you're nice and refreshed and comfortable. That's what I would suggest. Course completion certificate will be issued once all class requirements are met, and there is no hands-on practicing or skills evaluations in this class since it is online. The minimum pass rate score is going to be 75. You have 3 attempts at the unit quizzes to score 75. Quizzes may be reattempted up to 3 times until a passing grade is achieved. The final exam, you got to score a 75. It's a 100-question exam. You have 3 hours to complete it. The final will be able to be attempted 3 times. Students must meet all course hour requirements. EMS University requires at least an 80% attendance to receive credit for completing this course. It is the student's responsibility to ensure that they meet all the requirements for recertification with NREMT and their state offices. Some places require you to stay in our NREMT, like here in Texas. It's actually optional if we want to keep our NREMT or not. So I thought it was just smart to keep up with it. So, and also too, if I keep up with my national registry, I get to do less CEs. So it was like a win-win for me. All right, so the prerequisites. The current, you got to have a current paramedic certification. You need to be recertified or licensed in the U.S. or any of the jurisdictions. Current NREMT or national or NRP or higher level of registration. Attendance addressing requirements for eligibility for the NREMT reinstates as a prerequisite for NREMT paramedic certification examination. So this is how our course is broke down. It's going to be a 48-hour course. We're going to have 16 hours of airway, breathing, and cardiology. We're going to have 8 hours of medical emergencies. We're going to have 6 hours of trauma emergencies. OB pediatrics is going to be 16 hours, and then operations is going to be 2 hours. So this is our mission statement. Our mission statement is that we are trained and educated individuals to become the most highly skilled emergency service professionals. Continuously quality improvement is the primary focus of our education training program. We take every possible step to instill knowledge from our previous experience through continuous evaluations and improvement. Each member of our team participates in this process. As an atmosphere leads to innovation, quality education, and instruction, our students will be trained to the highest standards and exemplify the characters of our organization after successful completion of their course or program of study. So here's our course content. This is literally everything that you will be going over in the next 3 days. Some of it, like I said, it's going to be live. Other parts is going to be online review. So we got program introduction. We have the NHTSA EMS standards, the EMS provider safety, the professional paramedic, paramedic wellness and injury prevention, paramedic safety, medical, legal and ethics, EMS and the public health service, critical thinking and patient assessment, new advances in patient monitoring, complex patient presentations, pathophysiology, pharmacology, airway, cardiology, neurology, endocrine, hematology, toxicology, gastrointestinal and genitourinary, infectious diseases, and psychological behaviors. Fair warning, people, I suck at medical terminology. So a lot of times what I will do, instead of actually saying the word, because I have my mom's genetics, she runs around saying she can't say zombie. What she does is she actually says yamsies. But I have her genetics, so I have a hard time saying some of the words. I understand what they mean. It's just that whenever I try to do it, it's like trying to speak a foreign language to me. I just cannot wrap my tongue around it sometimes. Sometimes I have my good days, sometimes I have my bad days. But I'm outside of my element today, so I have a feeling this is probably be a bad day when it comes to medical terminology. All right. We're also covered kinetics of trauma, shock, soft tissue injuries in birds, orthopedic trauma, spinal trauma, traumatic brain injuries, abdominal trauma, thoracic trauma, and the geriatric trauma patient, environmental emergencies, obstetrics and gynecology, the pregnant trauma patient, neonatology, pediatrics, abuse and neglect, mass casualty incidences, response to terrorism, hazardous material responses, and also review for the final exam. All right, so let's go ahead and get into our first section. It is going to be the, let me make sure, let me look at my schedule here. We're going to start jumping to the NHTSA EMS standards. We're going to be reviewing slides 27 through 41. Let me see here. All right. All right. So the National EMS Standards, the NHTSA published the National EMS Education Standards in 2009 in response to the EMS education agenda for the future. It's a systematic approach to EMS and how to train individuals. It is developed to replace 85 DOT EMTI and the 99 EMT NSC curriculum. What they did is they basically redesigned the system, and instead of us having all these different classes, they just basically simplified them. There used to be the ECA, which is the emergency care attendant, the EMT. Then you had the intermediate, which was the EMTI. You had it at the 85 and the 99 level. And then you had your paramedic, or it was your EMT paramedic. So what they did is they simplified it. Instead of basically have all these confusing rules and everything else like this, they just made it simple. We're going to cover the emergency medical responder, which is the old ECA, the EMT. Instead of having 2 intermediate levels, they just have the advanced EMT now. And then instead of us worrying about license or certificate paramedics, it's just now paramedic. Everybody's trained exactly the same. So everybody's getting the same national curriculum straight across the board. Although the paramedic level did not change, the education standards expanded the depth and context of the paramedic's core knowledge and objectives. Things have changed a lot over the last few years. So the older individuals, it's best to either take refresher courses to keep up with the newer things that are out there, or stay really on top of your continuing education. My thing I like to do is I actually like to read a lot of medical journals and see what different EMS services that are doing that are making our service or our profession that much better. Like right now, I'm a really big push. I'm trying to get my medical director on board of since we were extreme. I work for extremely rural 911 service. We're about an hour and a half from any trauma center. It's hit or miss that the helicopters want to fly. We don't have a stroke or cardiac center nearby either. So I'm actually trying to push us to get antibiotics on board for our major trauma calls. I'm also trying to develop curriculum or basically designing a system where we can work with the local hospital to help us identify strokes and cardiac events in the field, so we can look at getting drugs like TPA on board sooner. So we could basically take them local, we get them all situated, they run a scan, neurologist looks at everything, says, oh yeah, you're good, ship them to me now so we can administer TPA while en route to the next facility. So I'm really big about the clinical side of EMS. Although the paramedic, okay, I've already read that. All right, so the integration of the new standards would depend on the EMS service, EMS educators, and also state EMS offices to ensure that the national scope of practice model is covered. Although this may or may not be a fully implemented in the near future, all EMS educators are obligated to present the most updated and current information to the students. Paramedics, on the other hand, have the responsibility to stay current with at least medical information and relevant to their respective levels of pre-hospital practice through continuing education. The National Association of State EMS officials published the gap analysis template in 2009 that compares the knowledge and skills required of the new education standards to the DOT curriculum of 1985 and also 1999. These changes include the deleted skills and revision of information and expand skills. Following these slides, always refer to your system's protocols prior to initiating a change to your practice. So keep that in mind. Even though they may have changed the curriculum, they may not necessarily be covering this certain skills anymore. It's still ultimately up to your medical director if you're allowed to do certain skills that may not necessarily be taught anymore. The good examples I always laugh about is the mask pants. When I first got certified I started off as an ECA. Mask pants, we had to go over mask pants, and we were literally the last service in South Texas that I knew that carried them. And so they always smelled they smelled horrible. I mean, they smelled like a boys' locker room. But we used them whenever we can. We also would practice with them because this is just something that we just never used very often. Until one day they just disappeared. I'm really not sure where they went to. I think they probably somebody finally threw them away or either that or our director changed it, and I have no clue where the pants went from there. They just vanished overnight. But that's a skill that's basically prehistoric. But here in the state of Texas, we are still required to check off all EMT students on that skill. All right, so these are skills that are no longer taught to the paramedic students. So hemorrhage control, we're no longer doing pressure points and elevation. We just now focus on direct pressure and then tourniquets if we can't control the bleeding. Umbilical vein cannulation, urinary catheterization, and also restraint of any patient in the prone position. The transition, these are the new skills that the paramedic should be able to do. Know how to use a BiPAP or CPAP, waveform capnography, assisting with insertion and monitoring management of chest tubes, percutaneous criciotomies, assessing indwelling catheters in implanted central IV ports, and also central line monitoring, IO infusions in the patients of all ages, transnasal nasal medications, eye irrigations with the Morgan lens, initiation and monitoring of a thrombolytic medication, and blood chemistry analysis and cognitive material to understand the implication of results. So the professional paramedic, let me make sure this is okay, slide 19. All right, we're still on track. All right, so the professional paramedic, the professionalism describes the conduct qualities that characterize a practitioner in a field of occupation. Okay. If y'all ever know, let me take a break real quick. If y'all ever notice that my internet is kind of skipping out, or maybe it sounds kind of scratchy or kind of broken up, just let me know. And what I'll do is I'll slow down a bit to kind of give my internet a chance to catch up. Y'all will notice it before it actually starts flashing on my end that my connection is weak or my internet is unstable. All right, so the healthcare professionals promote quality patient care and takes pride in their profession. It's also good to try to set very high goals and try to achieve those goals. If you fall a little short, don't be discouraged, just try again or try to find other ways to reach your goals. They also earn the respect and confidence of team members by performing their duties to the best of their abilities and by exhibiting high quality respect for their profession. Professional practices practice their skills and point of mastery and continue practicing when improve to stay sharp. Non-professionals will do not believe in practicing the skills will fade and see no reason to constantly strive for improvement. So you got two different paramedics out there. You got one that likes to push forward. They like to take every class they can. They try to get on different types of committees. They like to catch all these different certifications that they can. They try to thrive to make their service better. Then you got other ones that basically just show up there for a paycheck. They're going to do the bare minimum skills. They're going to do the bare minimum on their patient care. They're basically just trying to get the patients from point A to point B, do the run report, and then go back to their leisure time. So try to strive to be one of those great paramedics. Professional understands the importance of good response times, and also non-professionals get the scene of the emergency when it's their convenience. Professionals take their refresher training seriously because they know that they are going to have forgotten the finer details of their craft and are eager to be informed of news, trends, and skills. Non-professionals believe that they do not need training sessions and dislike being required to attend them. Professionals set a high standards for themselves, their crews, their agencies, and their system. Non-professionals aim for the minimum standards and seek the path of least resistance. Professionals critically review their performance, always seeking ways to improve. Non-professionals look for ways to hide their inadequacies and place the blame on others to protect themselves. Professionals always check their equipment prior to the emergency response. Non-professionals hope that everything will work and everything will be in place because they left that responsibility up to somebody else. So a good example of that is unit checks. My biggest pet peeve is having everything on the truck when I get on shift. I have several people that I follow at work that will not fully restock because their deal is like, well, why do I? It was there when I checked it off yesterday morning. Try proving it otherwise. So whenever I get on shift, I do an extremely detailed check. I'm not only looking at the if I have the exact inventory, but also checking the quality of the equipment that I'm carrying. Do I notice a bunch of open IV catheters? Do I notice that this is dirty? You know, I try to inspect everything that I can, make it a very detailed check. So I know that I'm response ready whenever that emergency does happen. So professionals live by the creed that all patients should receive the highest level of emergency care, and that they will be an advocate for the patient regardless of the race, religion, sexual preference, and socio-economic status. For true professional, they see this as a non-negotiable. Non-professionals go through the motions that consider patients at all times disrespectful, as another gomer, drunk, or frequent flyer. I see that kind of going both ways because not only do non-professionals but also professionals see that too, because you also got to take into your analysis of your geographic location and also what resources you have available. I have one drunk that I take like 3 times a week. He calls us for the same thing. My back hurts, my arm hurts, my knee hurts, uh, I can't pee. My blood pressure is high. I need you to take me to the hospital for my blood pressure. It's always the same thing. He always tries to convince us to take him to the furthest hospital possible, and I know why. He claims that they're going to be the ones that are going to fix him because his back is pretty well shot because he's a ranch hand. So what he does is when he gets off work, he works hard all day long, and he also one that likes to play hard. So what he does is literally he gets hammered every single night. He wakes up, goes to work, and does it all over again. So he wants us to take him to this bigger hospital that says they're going to fix him because they're going to do something about his back. Well, that's not necessarily true. What it is he wants to go there because once he's discharged, they call the cops. The cops ride him and give him a ride all the way home, which our local hospital, what they do is they go there, they evaluate him, they see if there's any kind of life threats, if there's anything wrong. They figure it out. It's the same problem that it is every night, that he's intoxicated, because what he does as soon as we get him in this hospital bed, he falls asleep. Both hospitals are going to do the same exact treatment to him. It's just one of them will arrange treatment with law enforcement, where the other one says you got to sit in our lobby until you can find your own ride. So he always tries to make us go to the further hospital to so he can get that ride back. Now with him, I treat him to the highest quality I can every single time, because one of these days he's going to burn somebody. He's going to have a true emergency, and everyone's going to treat him as if it's just another tote, basically. So, all right. So the professionals see the excellence in their goals and never allow themselves to become satisfied with their performance. It is also not based off of income, but also based off of outcome. As a result, you may be a hardworking, dedicated professional who will not compromise to their highest standard of patient care or belief. It is realizing that you, as a paramedic, have to address your shortcomings and deal with them immediately. All paramedics have weaknesses in their skills or knowledge base. Find them and fix them.